from County Durham to Japan. A scanner, which has been developed in Sedgefield, has recently been showcased at a world-leading medical conference in Yokohama. Scientists behind it say it can detect tumours in dense breast tissue quicker and with better results than mammograms. I spoke to Dr. Arnab Basu, who is the Chief Executive of Kromek, to find out more.
So this technology is really aimed at women who have dense breast tissue for whom mammogram is not the most effective method of screening, because dense breast often can hide cancerous cells because they almost look the same in an X-ray image. The dense breast looks like white cloudy texture, and so does cancer. So cancers can be hidden among the dense breasts.
And can I just ask how you would know? How would you ever know if you had dense breasts?
The moment you have your first mammogram, you know whether you've got dense breast or not, because the mammogram clearly shows whether the degree of dense breast you've got and whether you've got it or not at all. So the way the technology works, there is a radiopharmaceutical, which is a radioactive material, very, very low dose, that is given to patients like any other nuclear medicine procedures that happens in hospitals today, like SPECT or PET scans. And that radiopharmaceutical is specifically designed to go and attach itself to cancerous cells. The detectors or the MBI system actually detect where that concentration of radioactivity is. So it shines almost out from the breast like a light shining out, and the detectors actually detect it, and that's how you can locate and identify and detect cancer at a very, very early stage.
Now, I understand this, all this research that's being carried out here where we are was showcased on the international stage. Was this in Japan? I mean, that's exciting, isn't it?
This technology was showcased in Yokohama in Japan. The technology has been, in development over the last 5 or 6 years, really enhancing the current MBI, which is available in America for women to already go through screening if they have got dense breast. But that screening takes about 40 minutes, and that's a very long time. So the aim of the collaborative research between Kromek and Newcastle Hospital, Newcastle University, and UCL was to bring the scan time down to around 10 minutes, and also the amount of radiation you have to apply down by a few factors. So all of that early results are showing really, really good set of outcome of this 5 or 6 years of intense work here, and we are able to show that very, very good quality of imaging can be done in and around 10 minutes or under 10 minutes with a much reduced dose to the patient. So this technology is showing real promise to be brought into the clinical pathway and hopefully into the screening pathway for women with dense breast tissue in the future.
Do you know when it will be used on the NHS?
So the next step is to go into a wide-scale clinical trial, which we hope can happen within the next 12 to 18 months, and then we hope that and expect that beyond that, this can be brought into an offering within the NHS. So these things take time, but these are very early and very, very promising steps that has been taken over the last few years. And it is a technology which is ultimately, we are confident that it'll improve the quality of life for many, many women, and ultimately probably save lives as well.
How fantastic. All developed at Kromek in Sedgefield. Absolute game changer for many, many people, which is absolutely fabulous, isn't it? It's great to see the brilliant work going on across our region.